back, there will be a sound like Velcro. When you open the Velcro, parang ganon. It's like that, no? Especially during the inspiratory phase, when the patient inhales, and usually it's heard at the base of the lungs. Then we check using a spirometric study to assess about the lung volume of this patient. Diba? Restrictive means smaller lung volumes. So we can do that and document it by doing a spirometric study. And another important parameter to use, or armamentarium to diagnose, is imaging. So if a patient comes to us, with an X-ray that is not improving, it's always read as pneumonia, then that's the time we would think of doing a high-resolution CT scan to see in a more accurate way what's going on. And this is where ILD can be diagnosed and monitored for progression over time. So just to sum up how we diagnose, it's an accurate history and physical exam, noting social history, smoking, exposures to environmental fumes, drug exposures, and radiation, doing a pulmonary function test to establish shrinking of the lungs. Lab tests may be done to rule out or rule in connective tissue diseases, and plus minus a biopsy to confirm. All of these information is discussed in a multidisciplinary team approach with the pulmonologists, rheumatologists, radiologists, and ano yung isa? Pathologists. All right. So we come together, we discuss, and the consensus diagnosis is made and plans are made for these patients. So that's how we diagnose symptoms of cough, progressive shortness of breath, Velcro-like crackles on physical exam, restrictive pattern on lung function testing, a CT scan imaging that will point in the direction of interstitial lung disease, wrapped up by a consensus diagnosis with a multidisciplinary team. So doing that approach nowadays will be better for our patients with this condition, because the impact of ILD is similar to airway diseases, but even more pronounced. They are more short of breath. Their reduced quality of life, it comes much sooner. And so there are ways to address this. Let's go through the general management strategies. Of course, yung pwede natin emphasize sa patients, smoking is the best way to prevent airway or interstitial lung diseases. It is the most cost-effective intervention established even in scientific studies. So it can reduce the risk of progression or the development of either COPD or even interstitial lung conditions. No pharmacologic intervention has equaled the effect of smoking cessation. So it's really important. Our potential patients can save money by avoiding this habit, and they can also save money by not needing extra support from family. So for COPD or airway problems, what are the general recommendations? Of course, on the right side of the screen is the cross-section of the airway obstruction. What we want to give them is a bronchodilator. So there are medications to address that. So we manage the symptoms and reduce risk for exacerbations by giving them bronchodilators, which come best in the form of inhalers. Right? Then, of course, we emphasize physical activity. Right? Physical activity is very important because, as you can see in the middle of the screen, if you are very active, the 4-year mortality rate is 0. Okay? Sedentary, 9%. But if you're very inactive, just sitting at the table all day, most of the time, or just lying down, for our COPD patients, death comes sooner. Okay? 31% 4-year mortality. So there is an interaction that comes about with doing increased physical activity in a setting called pulmonary rehabilitation, where the patients are guided and monitored properly. And the outcomes of a pulmonary rehab program will be in the form of improving quality of life, reducing difficulty of breathing, by teaching them, aside from exercise training, breathing strategies, as we've heard from our breathing experts, ganon din ang tinuturo namin sa pulmonary rehab. And how to combine that with physical activity. Breathe in, breath hold, exhale slowly through pursed lips. Then we add non-exercise training in the form of nutritional support, psychological support, symptom control, and how to go about activities of daily living, traveling, its intimacy in these situations. Same with interstitial lung disease. The spectrum of management includes pharmacologic as well as non-pharmacologic, which includes oxygen support and management of comorbidities. Lung transplantation in other countries is also part of the management strategies, but we have yet to see our first lung transplant in the Philippines. So what are the simple tips for maintaining respiratory or lung wellness? Make today count, stop smoking, stay active, eat nutritious food. So ganun pa rin yung pyramid, no? More veggies, less red meat, less sugars. Get plenty of rest, practice relaxation techniques, breathing strategies, and stay positive. Stay positive by joining a support group, and if depressed, contact your doctor who might recommend assistance from a specialist for mood enhancement. Okay? Keep in touch with family and friends. Work well with your healthcare team. That's what you have to give them an avenue for them to communicate with the healthcare team. And the best way is through our pulmonary therapists first, and pulmonary fellows, and then our consultants. Encourage your patients to prepare for their doctor's visits by making a diary, establishing goals, plans, and what to do to achieve those goals. And at the end, you also have to discuss the hard things to discuss, like end of life and advanced directives, because these conditions are chronic and progressive. It's not too early to discuss this. There is a moment that the doctors will have to not wait for the last moment, that if this patient seems to be progressing rapidly over time, you have to open discussion with them on what you want to do in your end of life. Okay? And so the key messages for this talk are to recognize that chronic airway diseases that are non-communicable and interstitial lung diseases lead to significant health status impairment, marked by exacerbations and flare-ups, increased hospitalizations, and burden of illness. Early recognition and detection is very important by consulting the physician, running through the diagnostic tests I've shown you, and from there, aside from pharmacologic intervention, remember that the non-pharmacologic intervention is as important. So appropriate inhaler technique, if that is what they need, has to be addressed. Identification of triggers for those who are asthmatics. Identification and management of comorbidities like what? Hypertension, diabetes, reflux, malnutrition, and of course smoking cessation, vaccination, physical activity increase through rehab or pwedeng non-rehab based, oxygen therapy if needed, and more. Alright, so with that, I thank you for your attention, and remember that August is Lung Month and September is Pulmonary Fibrosis Awareness Month. So in behalf of the PCCP, we'd like to thank you for your attention to this short talk on how the lungs work. Ms. Gia?